You don't need lots of rotation, so just round to there, and side bend with your leg, extend, and then bring that rotation. And then 3, yeah? You don't need lots of rotation, so just round to there, and side bend with your leg, extend, and then bring that rotation. And then 3, yeah? So, dorsal lumbar modified dogs, yeah? You would do that normally, is that an option that you would use?
Yes.
So I'm just going to go through the way that I would do it, and this, you can apply the principles of this to any of the thoracic dog technique, which you're not supposed to call it these days, but anterior thoracic technique. Yeah, exactly. And the principle behind this for me is not having your fist underneath the patient's back for any period of time, because it's really uncomfortable. So if I roll her over, try and get my fist underneath there, roll her back, and then say anything like relax, or she's uncomfortable. So I'm not going to do that to her. So for that reason, mainly, I lift the patient's head and then get them to relax. So at this point now, I'm in control of her. So I could, if it was a big person, say, can you help me by just sitting up? Or if they're a smaller person, I can do it for myself. So what I will do, first of all, is bend my knees, which creates rotation. Then I'd straighten my knees, which creates the lift, and I can get my hand underneath and thrust. But if it's a bigger person, I'll say, help me. So we get around here and I'd say, okay, just lift your head for me, and then relax down. So when I say, if you could just sit up slightly, just 1, 2, 3, sit up, and then as she goes back down, bang, thrust. So that's how we're going to get there. Before you do that, you need to plot the coordinates of where your levers are going to be. It's not just a hit and miss. So, it's actually something you're going to feel. So before doing that, I'm going to put on the levers the way that you would normally. So I'm going to flex down below the segment, and keeping that flexion on, allow extension back up. So there's my tension point there. I can then add side bending and rotation to whichever's going to create more tension. So in this instance, actually side bending to her right side and rotating to her left creates more tension. But you can go the other way. You could side bend to the left and rotate to the right. Yeah. So we can go through that higher up, but in this instance, take my word for it, side bending to her right and rotation to her left is definitely creating more tension. Yeah. So that's my point. So I know exactly that point there is where I'm going to thrust. I've got to remember that point in space when I get back to it. Yeah, now that just takes time to coordinate. So lift your head for me and relax down. Okay, I'm going to do the work for you. So all I want you to do is just take a breath in and out. And she feels my fist in her back just at the time of thrust. Yeah, which is not very comfortable, but by that time it's done. And if you get good at it, you can do it without them even feeling, you know.
Do you have them with bent leg or straight leg?
It usually you would have the knees bent up. It depends on the lumbar spine. I mean, in fact, you've got quite a flexed dorsal lumbar, so it was actually quite good having them straight.
Yeah.
But usually people have got lordosis, in which case you're better off having the knees bent. But you know, you should feel for what works best. Okay, so but that's relatively familiar territory. Yeah, so let's just look at that higher up in terms of the rotation and side bending. This is particularly important for the ribs. So if I roll her into this position, she's already rotated to the right. So it would make sense for my side bending to be to the left, because you have reverse side bending, reverse rotation, don't you? So that, I think, is the most comfortable way to do it. But you can go the other way, which is to side bend her to her right and rotate to the left. That means rolling right over the top of her, which means more compression. So a lot of the time I will, if I can, do it with rotation to the right if I'm on this right-hand side. But you need to play around with it. You know, sometimes it just feels better. As I say, in her, down at the bottom there, it felt better the other way. Good? spine in general is the biggest problem most of us have is we overlock. So I want to try and splint this lumbar spine and make it work as a unit. So I'm just going to put her into a position where there's a potential for the rotation to come in and around this sort of area. Then I'm going to refine that once I get to it. So what I'm going to do is splint her lumbar spine by pulling it into side bending, like so. Yeah, so at the moment, if I pull towards me there, rotation is going to happen from here up to here. Yeah? But if I drop like that, I've side bent it, and then pull, the rotation is now happening up here. Yeah? And the same thing with the thoracic spine. If I just keep pushing with this, she's going to keep on rotating all the way down into her lumbar spine, yeah? Whereas if I compress down like so, and then rotate, I can refine it and minimize it. So the compression is not heavy duty, but it's just taking the play out of tissues. Yeah, so like so, and then rotate. And again, you can look at either side bending this way or this way. Actually, with her, it's easier to side bend like so. So I'm side bending her to the left, really, not side bending her right. Here, I'm side bending her to the right. So you can see I'm using all these different components to reduce the rotation when I eventually put it on. So I'm side bending to her right, I'm side bending to her left, and then compressing. Now I'm going to rotate there. Now the rotation comes into this point here, not through here, yeah? So you've already honed it down into this area. And especially with mobile patients, you need to be doing stuff like this. Because if you just use your conventional way of winding up, you will just overlock. So if I just go back onto your shoulder, it's difficult without a plinth cover, but if I said, okay, let's put her in, you'd put flexion up to try and flex her up through here, then you'd allow rotation. Yeah, so that's going to go. Now, if I don't do anything to control that rotation is going all the way up there. Now, I'm going to put rotation from above down. I'm going to pull. First bit of rotation is all just her shoulder. Next bit of rotation is her scapula. Now I'm rotating her spine. Okay, I have her looking up to the ceiling. And where's that rotation? It's coming all the way down to here. I've just rotated from here up here, so she's now overlocked from here to here. And then you'll go, oh, I can't get this to go. Funnily enough, it's completely overlocked. And if you do try and get it to go, you're going to traumatize tissue. And that's exaggerating it. Yeah, so this is minimal leverage. So we just put her into a position where we can then control the levers more locally. So I pull her scapula through, so she's in a position where she can rotate, and then I control the amount of rotation. So instead of having a hand here, I'm going to have a hand up here. So I'm limiting the amount of shoulder movement. I come in here, I'm then going to splint the whole thorax, and I control that rotation. Yeah? You see that? Mm-hmm. So if I push like that and just have my hand hole here, rotation can go anywhere. If I splint her, press down like that, and then the rotation is just coming to where I want it to. Then same thing with this, but this time we're going to use side bending to control the lumbar spine and then pull in here. So at that point there, you then got localized levers without overlocking. Yeah? How's that feel?
Yeah.
All right? Good.